So glad to have you with us. Thank you for checking us out here on the HealthCall Live Radio Hour. Glad you are making us part of your busy Saturday morning. Well, this was supposed to be the week that we got over the hump. The peak week for COVID-19 here in Indiana. What's going on? What's the sense of how things are going at hospitals around this state? And we're going to find that out as we talk with our guest today, Dr. Scott Myers. He is in the studio with us. Good morning. Thanks for coming in.
Well, thank you so much for having me again, Mr. Kelso.
So, hey, let me explain Dr. Myers to you. He is the assistant professor of medicine at the IU School of Medicine here in Fort Wayne, previously teaching at Georgetown University in Washington, D.C., also in practice, formerly at Lutheran, now at Ascension Hospitals, and you have a master's in public health. So all of that behind us. Let's talk a little bit about what you're hearing, what's happening in the hospitals. How's everything going?
Well, as most people have heard, we're not meeting or exceeding our hospital capacity, meaning there are plenty of open beds. And what I've seen is that there are some areas of the hospital, such as the respiratory therapists who work with the ventilators, who are more busy than normal. But other areas of the hospital, such as labor and delivery or the orthopedic surgery, are actually so slow. In fact, there's sort of a shelter-in-place feeling even in the hospital with a lot of providers looking around saying, hey, let's get busy again.
Yeah, that's something we're going to talk about a little bit later. And one of the secondary fallouts of this virus is that it's going to cause some big changes in the way healthcare is going to unfold here in the next rest of the year and then into next year. So we'll talk about that a little bit more. So the state of Indiana is reporting that we have 2,915 total ICU beds. And according to the information I found on the website, 21% of those are occupied by COVID patients. So if I'm doing the math right, that says in all of Indiana, there are 638 COVID patients currently in treatment. Does that sound right?
Yes, that makes sense. And I don't think there's any question that we've been relatively fortunate in terms of the crisis not being as bad as it could have been. And to use the old sports analogy, we look at also not where the ball is, but where the ball is going, so to speak. And I do think that the phased reopening plan makes sense to carefully allow people to get back towards normal. But there's no question that there's been no movement towards any surge thresholds or really any dramatic changes in hospital practice. So
you have no concerns that in this reopening campaign that we're about to enter into, that hospitals and the healthcare system can't meet the demand?
That does not, there's no reason to be concerned about that at this point. Obviously we don't take anything for granted, and it's important to take unknown waters a day at a time. But again, all the evidence and the data, as you just mentioned, shows that there's not any eminent concern about that.
And of course, there's always the fear that there'll be a rebound once people start circulating more widely, and people who are asymptomatically spreading could then accelerate, and we might see some bounce back. So I know everybody's on watch for that, but that's interesting. I did talk to someone who just came off, in fact, a respiratory therapist who just came off the overnight shift in an ICU ward that is specifically for COVID patients in Indianapolis. And her report was that many of the patients are expiring. They're deep into the disease, and so she's not seeing a lot of patients recover. They tend to be dying. But if there is any good news, it's that those beds are not being refilled very quickly. So that kind of contributes to the notion that we are on the downside of this thing. But as I just said with Rob a moment ago on Midwest Ag Matters, there is concern across the country that we shouldn't be like a guy with a parachute on our back and you cut the parachute off at 1,000 feet, or that you started taking the antibiotics and you feel better, and so you suddenly stop taking your meds and the disease bounces back. Do we have any indication as to the likelihood of that occurring?
Well, again, I think it's important to stay with what we know and not get ahead of ourselves in terms of speculation. And that's where I think we're fortunate to have such strong leadership with Dr. Fauci and Dr. Birx and the NIH team working with President Trump and the Vice President. And I do think that they're considering all these things and using good judgment. And so I think the phased reopening process is one that makes a lot of sense and should provide us all reassurance that we're not going to get too far ahead of ourselves in terms of reopening too fast. But again, I think it's important to acknowledge what we don't know and take it a day at a time.
And so what we don't know is the prevalence of the virus in the community, and that's where this sentinel testing is going to be occurring. Let's talk a little bit more about that so people really understand what that means. So as I'm watching the daily brief at the White House, Dr. Birx yesterday mentioned that they're going to be surveilling the vulnerable populations to try to get a sense of what this virus is doing. How active is it still? Can you tell me what that means?
Well, it's interesting that, there is some evidence, as you know, that the prevalence of immunity may be more widespread in the community. And so by identifying how many asymptomatic people, meaning those who are not sick, actually have antibodies, that'll give us a much better perspective of what is the actual risk of serious disease. So the more we see people who do have immunity, and maybe they either didn't know they were sick at all, or maybe they had a bad cold a few weeks ago and recovered and didn't think too much about it, the more that suggests that the probability, at least among lower risk patients, having serious disease could be very low. And so that's what we're hoping to find with this so-called sentinel testing, where they're basically just doing a large-scale cross-section of society to see where we're really at.
And are they testing for the presence of the virus or antibody testing or both?
Well, I think for the sentinel testing, they're looking more at antibody because that shows immunity and possible past exposure, which is different from somebody who's sick today and goes to the doctor and wants to know, do I have this thing? And that's where the so-called nucleic acid testing, a lot of the rapid tests are checking to see if you're positive, similar to a rapid flu test.
Yeah, and the number of tests administered in Allen County so far, I think I just saw at 1,457. So that's still a pretty small number. Are you hearing that tests are pretty readily available now?
Well, what I've heard is that the turnaround time is typically about 1 day, and this is mostly for the test of infection, typically the nucleic acid test. So as far as the so-called ID now, the 10-minute rapid test that is coming out of Abbott Labs, I don't think that's readily available locally, but we hope that it will be soon.
And that testing, I think we're talking about being on the backside of this curve, right? But if you look at the state report of testing and cases, it's still going up. And that makes sense because as we test more, you're going to find more. It's kind of like dust bunnies under the couch. Once you go looking for them, you find them, right? So don't be surprised that we're seeing the number of cases go up. Are they taking a look at hospitalizations, or are they taking more of a look at actual testing volume and positive cases? Do we know yet what's going to be that trigger?
Well, from the data I've seen, they're looking at all of those and keeping count of all of them. And there is some controversy in terms of the counting methods regarding the decline. So, for example, if somebody was sick 3 weeks ago and it's just reported today, some of those tests are being counted as so-called new cases when in fact they're really more old. So there are some challenges. I think a lot of people are still figuring out the accounting methods, and so all of those numbers are being counted, but the interpretation is somewhat debatable.
And then, you just mentioned the antibody testing. I think there was a lot of headlines. People may have heard that in Santa Clara County, California, there was some testing by Stanford University that indicated that maybe more people are immune, have been more exposed than we ever thought. Now there's some additional reporting that maybe that testing is flawed. What's your sense of that? Is it likely that there's a higher level of immunity than we might have thought?
Well, that's where the sentinel testing is specifically designed to answer that question. So as you know, scientists and physicians, we don't like to speculate too much. We'll find out the data. But if I would make a guess, an educated guess from the Stanford data and what we're seeing, I do think that it's likely that the number of people who are listening today who might already have immunity is higher than thought. Now, to be clear, nobody's suggesting that a majority of the population is immune or that we should be lax about high-risk populations. Of course not. But I do think it's more than a few people who might be surprised that they're immune, even if they weren't sick, or as I say, maybe they had a bad cold a few weeks ago, they went to the doctor and they were told they were flu negative. Well, maybe that's something that we'll find out some of those people, in fact, did have the COVID and recovered.
Yeah, a lot of us remember that some schools were closed, and lots of people reported this thing that just hung on and this cough, and they felt miserable for a period of weeks. They couldn't get over it. Do you think we're going to find out? I guess, who knows, right? If we're going to find out that may have been COVID and you just were a mild case.
Yeah, that's right. This is very interesting. It's like we're in the first act of a public health drama, and I think these investigations are becoming a lot more interesting. And yeah, I would be guardedly optimistic that we'll find that the immunity, especially among lower risk populations, is higher than previously thought, which means the risk of serious disease is lower than previously thought. And again, that's what the Dr. Fauci's team is hoping to find with the sentinel testing.
So I'm going to steal a line from Dr. Myers. He said earlier this morning that it's kind of like we're all living in a CSI drama right now, and it kind of feels that way, doesn't it? Hey, we're going to take a commercial break, and then when we come back, we're going to hear from a guest on this program, previous guest, Dr. Ashok Kadambi. He has volunteered and is now in New York working in a hospital there. So we're going to hear from him on what he's seeing out there. We'll continue our conversation with Dr. Scott Myers, and we are glad that you're with us here on the HealthCall Live Radio Hour on WOWO, 1190 AM and 107.5 FM. And we have on the line with us a regular guest here on the HealthCall Live Radio Hour, Dr. Ashok Kadambi of Fort Wayne Endocrinology, who is dialing in this morning from the Flushing Hospital in New York. Doctor, good morning.
Good morning, Lee.
And I will explain that you are speaking through a mask because you're in the clinic right now. Tell me, what are you doing out there in New York?
Yeah, I've been assigned to the inpatient floor on the second floor here at the Flushing Hospital. Most of these patients are COVID patients, positive patients with respiratory problems, but not sick enough to get into the ICU, but really they can be sent home because they're on oxygen or medications. So they're sort of hanging in there between now the option of either going to the intensive care or being discharged. So one of two outcomes.
So what kind of care are you providing? What tasks are you performing?
Basically, evaluating the patients, writing the orders, formulating a treatment plan, and then making decisions on whether they need to go home, stay on the floor, or go to the ICU.
And I would assume that your specialty being endocrinology, we're seeing a lot of these COVID seems to be worse in patients who are diabetic. Is that what you're seeing present with you?
Yep, absolutely. The same experience here. Diabetes, I think hypertension, obesity, they tend to predispose these people for complications from the COVID to get worse.
So we are feeling as though here in Fort Wayne we're on the downside, that the pressure is lessening. What's the sense there?
Much better this week. It was absolute mayhem 2 weeks ago, and now things are much better.
Well, that's great. Dr. Myers, do you have anything you want to ask?
A lot of people here locally are interested in the treatment options. For example, I've heard a lot of people ask, if I get sick, is something like the hydroxychloroquine with zithromax and zinc combination available to me? And also, are you using the convalescent plasma? I saw that the FDA issued guidelines for convalescent plasma candidates. What are you doing there as sort of your first line treatment for patients who are sick with the COVID?
Well, everybody, a standard operating procedure here, everybody gets hydroxychloroquine and zithromax. It's standard. Everyone gets it, okay? Of course, for 5 days. And then they evaluated whether they need others. If they still have inflammation, people look into doing things like interleukin-6, IL-6 antibodies, and perhaps the new one, Remdesivir, that is just approved by Gilead Sciences. They've started using that on a limited basis on very sick patients.
On very sick patients. You know, we were just talking about that earlier. So remdesivir is a polymerase inhibitor. So what it does is it confuses the RNA within the virus so that it can't replicate and then take over your system and cause that cytokine storm. So one of the criticisms about how that's being used is it's too late in the disease process to be truly effective. So is it only after they're in ICU care that they're receiving remdesivir now?
Yeah, well, there's a short supply, and we're trying to keep it for the people that are critically ill. But I agree, this probably will be more effective when you give them very early. But they're part of they're part of a study. Let's put it this way: they're not using it in production mode, so to speak, but they're part of a national study that using, and maybe the protocol calls for using it in this kind of people. Maybe in some other hospitals they use it early.
What special counsel would you give diabetics who might be listening to us today?
Just stay away from sick people. That's all I can say. But also, you need to make sure that diabetics, the sugars are well controlled, and their immune. They take all the possible immune boosters, which includes vitamin C, vitamin D. This is all supportive care, probiotics. Mm-hmm. Yeah, this is just common sense stuff. Just take care of your disease better.
What's your expectation, Doctor? How long do you think you'll be out there?
I should be back mid-May, latest.
Okay. Well, please do.
By then, the epidemic has died down. Things are getting better anyway already here.
Oh, that's good to hear. That's good to hear. Well, I appreciate you checking in. Thank you very much, and please do stay in touch. I'd love to kind of stay on top of things with you and what you're seeing, what you're feeling out there.
All right, cool.
Thank you. That's Dr. Ashok Kadambi from Fort Wayne Endocrinology, currently reassigned to the Flushing Hospital in New York. So good to hear, Dr. Myers, that they're having the downslide that we are.
Yes, that's interesting. And it's also interesting how you mentioned the importance of clinical trials. That's something we discussed on your last program. And I looked at the NIH website yesterday, and there's currently more than 600 trials going on for various types of COVID treatment. And certainly we all, as physicians, want to participate in these clinical trials as much as possible. And at the same time, as I mentioned before, it's important to look to a common leader like Dr. Fauci and his team for good advice, because people in Fort Wayne and Allen County are oftentimes asking, well, what if there's not a clinical trial to enroll in and I want to get some of these medications? And what I found is that the FDA has issued a so-called emergency use authorization to allow for these same medications, the hydroxychloroquine, Zithromax, to be given from strategic national stockpiles. And along the same lines, as he mentioned, remdesivir is being used for some of the more sick patients, and the drug company has made this available or is transitioning to availability through what they call expanded access use, which makes it available for people who can't logistically get into a clinical trial, which is clearly the preferred method.
There are a lot of impacts that we're going to feel downstream from this whole mess, and not the least of which is all the elective procedures that have been put on hold are now backed up and are going to log jam the system. So what's your anticipation? What can we expect as we ramp back up and try to get things rolling again?
Well, that's interesting. My understanding is that the ultimate discretion is given to each governor in terms of those rules and allowing activity to resume. But I have heard a consistent consensus among both healthcare providers as well as patients that some procedures and treatments which are being labeled elective might include doing a biopsy on a lump, or somebody who is in a wheelchair needs a total hip replacement. And a lot of people would like to take care of these patients because, again, somebody getting a form of cancer treatment or an important orthopedic procedure is not the same as, obviously Botox or hair plugs. And we want to make sure that we're taking care of those patients. So I think there is a strong desire to at least get back to those at least partially essential activities.
It sounds like we're going to be able to do that pretty soon. So we have to move into the second half hour of the program. Dr. Myers, thank you. You're welcome to stay around if you'd like to through the second half hour. We're going to talk in just a minute about what's happening in nursing homes and long-term care facilities. That's been a real hotbed of this disease. How are we going to manage that? And then we're going to take a look into contact tracing and how your smartphone could play an important role in that as we roll into the second half hour of the HealthCall Live Radio Hour on WOWO.